I'm Megan Jones. I'm here to interview for the open RN position.
Hi, I'm Rebecca. I'm the clinical director here at the ICU. Thank you for coming today.
Yeah, of course. Thank you for having me.
Yeah, so I actually just have a handful of questions to start you off with, okay?
Okay.
So to begin with, what would you say some of your strengths and weaknesses are?
I would say that some of my strengths would include I easily adapt to new situations and environments. I like to think that I'm a pretty reliable employee. I'm trustworthy. In any job I've had, I work very hard and I'm not afraid to ask questions when I don't understand something. A few things that I would probably consider a weakness for myself is I found that at times I have a hard time telling people no when I probably should, so I end up with a lot on my plate and can sometimes become overwhelmed with things. And another one might be that sometimes I try to handle things on my own without asking for help when there probably reaches a point that I should. So those are some things that I could probably use improvement on.
That's really good though. It's important to know that you're able to ask questions and you're confident on that. And our team here is really great about helping and making sure that you're not trying to take on too much.
Right.
How would your supervisor describe you?
I would think that my current supervisor would probably describe me as a reliable employee. And I've been there for about 4.5 years, so I've kind of become a leader in that position. And they probably mentioned that in like high stress situations, I usually have a level head. I can kind of stay calm in those situations and help navigate how we need to address things. So I think those are a few things they probably mentioned.
Very good. What work experience has been the most valuable to you and why?
So I have worked, like I said, I've worked as a CNA for the past 4 years. I'm PRN, so that means that I float between 3 units. There's memory care, long-term, and rehab. So some things that I've learned on the memory care unit are things like the importance of becoming creative with how you communicate and care for patients with memory loss. It's really made me think outside the box in some ways to meet their needs. Some other things on that unit that I've learned is being supportive of families as well, because there are times when they have a really tough time seeing the people that they love not always remember everything, and so it's taught me a little bit of the compassion side of it as well. And working on rehab with patients that are going to therapy, that has taught me things like time management, multitasking, and communication. Like I'm having to communicate with nursing as well as therapy to coordinate times for them and things like that. So, yeah, those things have been really helpful for me in the past.
Very good. So now describe an encounter with an angry or frustrated patient and family member and how you handled it.
So there was a time where I was working on our rehab unit. I hadn't worked for about 2 weeks, so when I went in, all the patients were new to me, so I was just trying to get a feel for everyone. And I went into this gentleman's room to help him get up for therapy that he was scheduled for at 7:45. And I walked in and I'm like, hey, your therapy at 7:45, like I'm gonna get you breakfast, so on and so forth. And he sat up in bed and he just kind of started yelling at me of how he had told me that he wasn't doing therapy that early in the morning and that I wasn't listening. And I mean, I immediately realized that there must have been another aide the previous few days that he had told that to that must have just not communicated it, that those were his needs, and just kind of encouraged him to follow through with it. So I told him I understood his frustration, and that I would speak with therapy to see if there was something that could be done. So it was a simple fix. I mean, I just talked with our therapist and we found a different patient who preferred the early therapy. So it was an easy fix. It was just taking the time to actually address it rather than kind of brush it under the rug, which I assume had been done before. So that was how I handled that, and he was fine after that.
Very good. That's a really good initiative. So now, what would you do if you noticed that your supervisor made a mistake?
If it was a mistake that immediately would put someone at risk or in any kind of danger, I would obviously address that right away in the nicest and discreet way possible. But if it was something that didn't need like immediate intervention, I would most likely wait for a time where it could be a private discussion, because no one likes getting like corrected or like that in front of anyone. So I would wait for an appropriate time and just discuss what I saw and what I thought. I know it can be intimidating to like feel like you're correcting someone above you, but I feel like as long as you're kind and just concerned with how you deliver it, then it should be fine.
Very good. So now, why should I hire you?
Like I said before, I just feel like I'm a reliable, hardworking employee. I'm really eager to learn more, and I know that I'm a new graduate nurse, so there will be a lot of learning along the way, but I'm excited to learn, and I feel like this unit will provide me the best opportunities to just gain a lot of knowledge and help me become a really well-rounded nurse.
Very good. So that's all the questions I have for you. Do you have any for me?
Yeah, I have a few, if that's okay. I guess first, I was just wondering how you are handling like protecting staff throughout the COVID that we're experiencing.
So our facility is actually doing a really great job protecting us right now. They got us the new PPEs, including some nice respirator masks to keep our staff and our patients safe. On top of that, we're doing daily symptom checks every time you come in. We're following up with everyone every day to make sure they're doing okay. But on top of that, if you do happen to be exposed, we're doing free COVID testing for those people, and we're making sure we have adequate staffing to make sure that we're not falling behind or overloading our nursing staff without when anyone's out sick.
Okay, that's great. And another thing, I was wondering what your typical nurse to patient ratio is here on the ICU.
That's a great question. We actually try to keep it no more than 1 to 2. Depending on the acuity of the patient, it might just be 1 to 1. And normally with that too, we also have our techs on the floor who will have about 8 patients, and they're able to help you throughout the day as well.
Okay, awesome. And then my last question, I was just curious what you all typically start new graduate nurses off at per hour.
We start at $29 here.
Okay, all right, that's great. I think that's all I have to ask.
All right, well, it was a pleasure having you. Thank you for coming.
Thank you so much for having me.
All right, have a great rest of your day.
Thank you.